Great. Thank you so much for the invitation. I'm thrilled to share with you some practical matters with regard to how to take a total worker health approach. So I am actually trained as an industrial hygienist and an occupational epidemiologist. So when I learned about total worker health, I was really interested, like how does this apply to traditional things that occupational safety and health professionals do, like hearing conservation? And so from that came the HearWell project. So today, what I hope to share with you is some more about the Center for Promotion of Health in the New England Workplace, building off some of the concepts that Dr. Chosewood presented. I'm going to share with you our approach to advancing worker well-being. I'm also going to describe a program, a freely available toolkit on how to take a total worker health approach. It's called the Healthy Workplace Participatory Program. And then I'm going to explain how I use the HWPP to address hearing health in the HearWell study. So let's get started. So as was mentioned, I'm from the Center for the Promotion of Health in the New England Workplace, or CPH-NEW, and we are one of the 10 NIOSH Total Worker Health Centers for Excellence in Research and Practice. So we are a joint initiative, not as many people represented on the screen as the New York, New Jersey ERC, which is quite impressive. We actually span across 2 states, UMass and Massachusetts, and Connecticut. We're at UMass Lowell, UConn School of Medicine, where I am, as well as UConn's main campus. It's a joint initiative because we know that multidisciplinary teams are needed to keep and get workers healthy. And so we bring in a variety of different expertise, as was mentioned, is important by Dr. Chosewood. We have 2 main goals in our center. The first is to implement and evaluate the effectiveness of workplace programs that approach health in an integrated fashion, or programs that take a total worker health approach. And the second one is to promote a participatory approach to engage employees at all levels in the design of interventions that simultaneously protect and promote worker well-being. So what you'll see is CPH-NEW's hallmark is a systematic grassroots engagement of the workforce. And so what we do through the HWPP is put workers in the driver's seat when it comes to building solutions for safety and well-being on the job. So as was mentioned by Dr. Chosewood, there are some defining elements of a total worker health approach. And briefly, some of them include demonstrating leadership commitment in both words and actions to worker well-being. It's also fundamentally designing a workplace that eliminates hazards, prioritizing that hazard-free work environment. Worker engagement is fundamental, and this occurs across the continuum of activities, as well as ensuring confidentiality. A data-driven approach is really the basis of a total worker health approach, and we often have to collect private health information. And so it's critical that this information is collected and protected in a way that workers are provided confidentiality and privacy. So data collection should not come at the cost to individual worker well-being. And last but not least, it's taking a systems level approach. So we know that there's lots of different people at a workplace that touch upon worker well-being, whether it be human resources, workers' compensation, chronic disease management, employee assistance programs, or occupational safety and health. They all touch upon keeping workers healthy, promoting worker well-being. Well, integration of those systems is key in a total worker health approach, and it can occur across definitely a continuum. So it can include things like joint meetings, or it can be coordination of events. For example, a health and safety fair that also offers information from employee health promotion programs, or it can be integrated program goals. We know that coordination saves time, money, and has been shown to be increased in effectiveness as well. So I'm going to focus a little more on engaging workers, which is a hallmark of CPH-NEW's approach to total worker health. Okay, chances are that many of you have a background in occupational safety and health, and whether you're a student, researcher, or practitioner in the field, you practice worker engagement. I'm hoping that your training or experience has shown you that workers are the experts in their own job. So take a look at that painter there on the right. As an occupational safety and health professional, I would not tell that worker how to do his job safely until I had an understanding about the task that they were assigned to do and the practices. So I'd go to that worker and seek to understand. Well, it turns out that when taking a total worker health approach, workers are also experts in their own well-being. And so let's talk about when, why, and how we engage workers in taking a total worker health approach. So when should we engage workers? Well, when starting off in a total worker health initiative, it's important to engage them at numerous steps along the process. So the first can be identifying the safety, health, or well-being challenges that are most important to them. And this might be different depending on different types of workers or, for example, different jobs, different work shifts. It's important to talk to workers to get that information. And then it's also important to ask them about what potential solutions are and also to anticipate barriers. Once an intervention or workplace initiative is implemented, workers become important in getting it up and running by promoting employee buy-in and participation, as well as identifying problem areas or places that need to be changed to support the long-term sustainability. Now, why is engagement important? Well, as I mentioned earlier, workers are the experts in their own job as well as their own well-being. So workers have that knowledge to uncover the root causes of barriers to well-being and can help to contextualize the solutions. In addition to leveraging worker knowledge, the actual act of participating itself has benefit. It improves employee self-confidence, and this can carry over into having impactful workplace changes that can ultimately help to sustain a program once it's in place. So now I'd like to talk to you about a free total worker health toolkit that embraces the fundamental elements and supports worker engagement. Okay, so CPH-NEW has developed the Healthy Workplace Participatory program as a toolkit to assist employers in developing, implementing, as well as evaluating total worker health programs that promote worker well-being. And you can see there's a URL there. I encourage you to go to it to take a look. The program itself has been field tested. So Dr. Cherniak mentioned the work in the correctional officers. We've also worked with healthcare facilities. There's lots of different workplaces and industries that we've tested the toolkit. And we've developed a number of materials that support its implementation. So we have user guides, worksheets, training videos, and it draws upon a structured planning process that uncovers the root causes to health, safety, and well-being issues and engages workers in designing solutions. So you'll see that there's a 2.0 in yellow. So in 2019, we launched a new edition of the toolkit based on the field evaluation that has been occurring in our center. And all of these are freely available for anyone to download and use. So I'd like to go into some of the core components of the Healthy Workplace Participatory program. And the first is the two-committee structure that helps put a structure in place to engage employees at all levels in talking about and taking action for safety and health and well-being improvement. So first, let's look at the different roles of the committee. The management committee is also referred to as the steering committee, and they provide resources, they oversee the program, and help support the implementation and evaluation of those procedures, programs, and policies that Dr. Chosewood mentioned earlier. And the second team in green is the design team, and these are front level workers. They bring that knowledge to the table and help to identify the root causes to hazards and health concern. And then they help to design the interventions and propose them to the steering committee. In the middle, you'll see that there's a trained facilitator that helps to coordinate the work of that worker-based design team and the management-based steering committee. And people such as ergonomics, safety managers, health and safety individuals, union leaders, really lots of different people could serve in this role. The key is having good people skills. So I'd like to say that this structure facilitates that integration that was talked about as a key component of a total worker health approach. So by including members of different departments in the steering committee, as well as the design team, we get an integration of the relevant structure. And I also want to call your attention to the arrows on the side, that action, feedback, and teamwork. And that represents the dynamics between the two committees. And in my opinion, it's one of the most important aspects. It's this communication feedback loop that's built into the process. So it gets people talking first with their peers and then across the organizational hierarchy about safety, health, and well-being concerns, which is critical for building a strong climate for safety, health, and well-being. So having those two committees is a simple way to structure those dialogues. So the next core component of the HWPP is the ideas tool. So it's a participatory method used by both the design team and the steering committee to develop integrated total worker health interventions and to create a business case for them. So the process helps to communicate and identify interventions in a way that's persuasive. So IDEAS stands for Intervention, Design, and Analysis Scorecard, and it's an evidence-based process. You can see the publication reference below in the Journal of Occupational Environmental Medicine. So the process has 7 steps, and the key thing to note is that the steps are designed to involve employees at all levels in identifying and addressing the root causes to a specific safety, health, and well-being concern. So through the process, employees create what's called a business case by applying key selection criteria to solutions that the team comes up with. And of course, the process is highly participatory, and the designing of interventions is done as a group process, and it can occur over a period of weeks or months, or even as a single-day retreat. So as I mentioned, the people who participate include the design team, that front-level, line-level employees, with feedback and participation from the management level steering committee, all led by a facilitator. So now I'd like to go over how we used the HWPP to address hearing conservation through the HearWell study. So as I mentioned, I'm an industrial hygienist, occupational safety and health professional, and I know that hearing loss continues to be a big concern in workplaces. It's an important work-related disease, and this is the case for transportation and warehousing section employees. So there's estimates that about 1 in 4 workers are exposed to hazardous noise, and 1 in 3 workers report not wearing hearing protection. And over 1 in 10 workers report having difficulty hearing. And this is the case for transportation maintenance workers where the HearWell study occurs. These are workers who repair state roadways and maintain state workers. They're state union-based employees. They work out of small garages spread across the state and work in crews to perform their work. So right now, during the winter in Connecticut, they're mostly doing snow or debris removal. In the summer, as the weather gets better, they also do paving, repair of bridges, mowing, as well as brush and tree limb removal, which is what's pictured here. So you can see in the top picture, there's a crew of 5 guys performing brush removal, and one of the hazards they face is certainly noise exposure. So in the picture of brush removal, some of the noise exposure sources include the chipper at the far left, that big orange machine that the worker is adding a branch to, and it also includes the chainsaw. And the worker in the white shirt in the far right is holding a chainsaw, the picture of which is inset in red. And NIOSH noise is measured in decibels, and both the NIOSH recommended exposure limit and the OSHA action limit is at 85 decibels, as you can see on the chart on the right. And you can see also that a chainsaw, which is the third one down from the top, comes in at about 110 decibels. So these workers are in a high noise environment. And of course, the ideal solution is to engineer out or substitute the process to reduce noise exposure. But oftentimes what we see in workplaces like these, where there's lots of different sources from noise exposure and the workplace is continually changing, workers tend to wear hearing protection. And in fact, you can see in the box in green a picture of the hard hat with the attached earmuffs that workers tend to wear. So the reliance of hearing protection devices in these variable noise environments like this is quite common. So traditional hearing conservation programs are required by OSHA when exposures are at 85 decibels or above, and they require several elements, including those listed here. And we know that OSHA has regulated noise exposures for over 30 years, yet hearing loss remains a problem in the US. A 2007 report from NIOSH suggested that hearing loss accounted for about 14% of occupational illnesses among workers. And I should say, while OSHA indicates what needs to be done, there's little guidance on how this should be performed. And this is where I decided to focus for the HearWell program. So HearWell for Total Hearing Health applies the participatory total worker health approach to hearing conservation by using CPH-NEW's Healthy Workplace Participatory program. It's certainly not comprehensive, unfortunately, given the limitations of the study. So we cover those elements in the X. So we did not touch upon audiometric testing or record keeping in the HearWell study. This was actually performed by the company themselves. So the difference in HearWell as compared to a traditional hearing conservation program is how the program was developed and applied using CPH-NEW's HWPP. So the hypothesis of our research was that the total hearing health approach of HearWell that uses the HWPP would outperform traditional hearing conservation programs. So what I did is I worked with 12 maintenance garages across the state and randomized them into 3 different arms. The first was 2 garages had HearWell design teams. So we used the HWPP and set up 2 worker-based design teams with them. 4 garages received all the interventions developed by the HearWell design team, but had no active design team members. So they were passive recipients of the materials developed, but no active employee participation. And 6 of the garages were considered the control, and they had standard hearing conservation practices and standard materials and training materials. And what I did is I periodically surveyed all the workers at each of the 12 garages We asked about hearing protection device use, both at work and home, seeing as it was a total worker health project. We were concerned about protecting hearing on and off the job. And we asked about beliefs and attitudes and behaviors about hearing protection and hearing loss using a NIOSH scale. And I'm sure some of you are familiar with the concept of safety climate, which is the way in which rules and regulations are implemented at the workplace, the workers' feelings about them. Well, safety climate often generally talks about safety in general in PPE without much specifics. And what we found from our worker-based design teams is that hearing climate was something different. So noise wasn't considered in the same way as other safety factors. And so because of that, with the input from the design team, we created a new hearing climate variable. So the first step to HearWell was to set up both the design team and the steering committee. So of course, the steering committee included key decision makers from health and safety, as well as from operations, facilities management, budgeting. There's a bunch of different people on that committee. And it was important to get their buy-in for this total worker health approach, as well as to make sure that the workers were given the time that they needed to attend the meetings, and eventually, when it came time to support and implement the workplace changes, all of those key decision makers needed to have that buy-in and give their support. So that's who the steering committee was. And you can see in this picture here, there's some of the design team members from one of the garages. This particular garage had 6 members. The other garage had 5 members. You can see they all have these workbooks open, which includes all the sheets that we use to record in the information and take us through that ideas process. They met periodically, ranging from every other week to monthly, depending on the weather. So of course, sometimes when storms occurred in winter, we weren't able to meet. And they went through that ideas process. I'm not going to cover each of the steps of the ideas process today, but I do want to draw your attention to a recent publication in the International Journal of Environmental Research and Public Health that provides much more detail about the HearWell implementation and assessment. It's also freely accessible, open access. So I do want to share with you what the design team members thought were the root causes of hearing loss. Of course, they knew that noise exposures were at the root cause, but they also acknowledged some other factors. One of them was a knowledge gap. So these workers liked things black and white. One said, "Tell me when to wear my HPD and I'll wear it." And the problem is that they were working with lots of different types of tools, and it wasn't always clear what the right hearing protection device was. They also recognized that hearing protection device was often uncomfortable and limited, and most workers were actually not trained on how to properly insert plugs or adjust muffs. Last but not least, this idea of safety climate or hearing climate was an issue. I'm going to share with you a quote from one of the workers because I believe it paints the pictures. He said, "If you asked a maintainer to bring me your PPE, he would grab his boots, his safety vest, his hard hat, and his eyeglasses. He wouldn't think to grab hearing protection." So clearly, hearing protection was thought of in a different way than other PPE. And so increasing hearing climate was a factor that they wanted to support. And in addition to an understanding of the workers, they also recognizes the role of the supervisors in supporting hearing protection, which was often dependent on which supervisor was on the job, and coworkers for supporting wearing hearing protection. So in the end, the design team came up with a few different components to address hearing health. And one was a noise hazard scheme that allowed workers to assess the noise level of a task and choose the right HPD. Another was a training. And the last but not least was a safety leadership training for supervisors. Let me go into a little detail about each of those. So first, the noise hazard scheme broke down noise hazards into one of three bands: red, orange, or yellow. And as you can see on the left, the different bands represent different decibels, and it outlined each of the equipment that a worker would work on in that decibel range and the required hearing protection. So this chart was made available in all of the garages, and it helped workers easily assess the noise hazard and choose the right hearing protection device. And the other thing they did was a safety leadership training for, these are for supervisors and crew leaders. And the Foundations for Safety Leadership is an elective in the 30-hour OSHA module. This is something actually that Dr. Schwatka had a role in creating. And it includes lots of different slides, videos, and exercises, and 5 amazing leadership skills that it stresses. That's lead by example, engage team members, actively listen, develop team members through teaching, coaching, and feedback, and recognizing team members for a job well done. We slightly adapted it to add a hearing protection scenario and to create, to add more information and context that was relevant for transportation workers. And last but not least, there was the HearWell training, and this included training on the noise hazard scheme, as well as topics required by OSHA. The training was done in the garage of workers. It was a 30-minute narrated video, including slides from Oregon's OSHA video for at-risk construction and trade workers, so workers similar to those in the transportation maintainers group. And it also talked about some design team topics, and that is coworker support for hearing protection device, so supporting hearing climate, as well as the importance of using hearing protection devices at home and at work. So did HearWell work? Well, yes, I'm proud to say it did work. So this is looking at the changes in beliefs about hearing loss and hearing protection. The dark orange is the post-training and the light orange is the pre-training. And you can see that we had high numbers for severity of consequences of hearing loss, benefits of protective action, and susceptibility at the beginning of the training, and saw little change in those. But we did see increase in social norms for using hearing protection device, the self-efficacy in using hearing protection, and what they saw was barriers to preventive action following the HearWell training. This graph looks at hearing protection device use. We asked workers, how often do you use hearing protections when you use noisy tools or in noisy areas? It was rated on a scale of 1 to always, 1 to never rather, to 6 to always. So we're looking for higher numbers. You can see there is an increase from study start before training and 6 months post-training. We also saw an increase in hearing climate, and both of these were statistically significant among the HearWell groups. So I really like this particular graph because it shows the benefits of worker participation. This graph plots the reported hearing protection device frequency across the study period. So on the x-axis, we have before we just started out. DT begins is when we began the design team. We had right after the HearWell training, and then 6 months post-training. So the y-axis is the hearing protection device frequency, and you'll see that there's dark orange. Those are the HearWell active, or the HearWell group that had the design team. The gray, which was the control group, and then the dotted orange, which was just the garages that had HearWell. So luckily, we saw an increase in hearing protection device use across all 3 study arms over the study period. And we saw the biggest increase in the highest frequency of HPD use in our HearWell active group. So in total, we the benefits of HearWell are that the workers were able to identify the root causes of hearing loss, and we saw improved hearing protection device use and hearing climate. The workers definitely felt empowered when they were asked to engage in identifying problems and craft solutions. And in fact, the Department of Transportation, where this was implemented, has started using the Healthy Workplace Participatory Program in the ideas process to tackle other health and safety issues, not just hearing. I just want to draw to your attention that when you think of implementing total worker health approaches, think of it as a developmental process. So you can certainly have a few elements all the way to an integrated program. And I think it's important to contextualize HearWell within this idea of a developmental process. It's not an all or nothing approach. And so HearWell did a good job in using a participatory approach to total worker health and to hearing conservation. And you can see that HearWell also addressed numerous components that are all relating to hearing protection device use, including safety climate or hearing climate and supervisor support. And it encouraged hearing protection device use on and off the job. However, in taking a total hearing health approach, I think it's important to consider lots of other factors as well. And I urge you to visit NIOSH's website, where they have a workplace solutions page on using total worker health concepts to address hearing health, which should involve eliminating or reducing noise exposure and may also involve taking a broader range of hearing health risk factors, such as ototoxins, cardiovascular health, smoking, and lots of other factors that we know influence hearing health. So I just want to end real quickly by sharing with you some resources. I mentioned the Healthy Workplace Participatory Program Toolkit, which CPH-NEW has. They also have a mailing list and lots of publications. I urge you to join our mailing list and to take a look at our publications and our website. And we also have lots of amazing free online training resources. The one that I'm really thrilled with and have been involved with is the Total Worker Health for Occupational Safety and Health Professionals. It's a course that's free online to train people with a background in occupational safety and health about total worker health. And you can submit, you receive a certificate of completion for continuing education requirements. So please take a look. And with that, I'd like to end with my information about my contact. I'd like to acknowledge my great co-authors, as well as the funding support provided to us. So thank you so much.